This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to answer the question, what is frozen shoulder pain like? Well, frozen shoulder pain is general pain in the shoulder, and it has to come with loss of range of motion. Now, this doesn't just mean that you can't move it. It means someone else can't move it either. So it's loss of both active, meaning you move it, and passive motion, meaning that someone else can't move it either. Um, so who normally gets adhesive capsulitis? Normally it's gotten by those who are a little bit older, middle-aged or older. Commonly happens in diabetics or those with thyroid issues. Sometimes it can also happen after trauma, like if you break your shoulder, or after shoulder surgery itself as well. But what ends up happening is the shoulder joint is surrounded by a capsule. It's kind of this thick layer, and mostly all the joints in the body have a capsule. And for whatever reason, this capsule gets really inflamed and it gets thick and it hurts. So why does that happen? Well, most of the time we don't really know. In medicine, we call it idiopathic, which is just a fancy word for we have no idea why this happens. But generally what happens is somebody will be in the middle age, either diabetic or has a thyroid issue, and their shoulder starts hurting and starts getting really, really stiff. Um, and that's what adhesive capsulitis is like. So what's the course of adhesive capsulitis? So there's three stages. Uh, there's the freezing stage, the frozen stage, and the thawing stage. And the good news is that adhesive capsulitis usually almost always goes away on its own. The bad news is that it can take a really long time. So each of those stages can last for a while. The freezing stage can last from anywhere to 6 weeks to 9 months. And that stage is when it really hurts and your shoulder is starting to get really stiff. That is that inflammatory stage that really hurts. Once you get past there, the shoulder doesn't hurt as bad, but it's stiff. We call that the frozen stage, and that lasts anywhere from 4 to 9 months. And then after that period of time, the capsule gradually starts loosening up, and you get into the thawing stage where you start getting your motion back. And that can last anywhere from 5 to 26 months. So for the entire process, you're looking from anywhere from about around 1 year up to 4 years. Now, 4 years is a really long time, and most people don't want to deal with that. So what do you do for adhesive capsulitis? I think one of the best things to do is steroid injections. That will get you out of the freezing stage and into the frozen stage, and that'll help you get better faster. It saves a lot of time and it saves a lot of pain. So that normally requires two steroid injections. One has to be inside the shoulder joint, and then one has to be slightly outside the shoulder joint in the subacromial space, and that will bathe the capsule and the steroid, and that will help everything calm down. Now, after you get that, you do need physical therapy for a long time, and you don't want it to be crazy physical therapy where you're really cranking your arm. We're talking gentle, passive range of motion for an extended period of time. Rarely, if someone's still stuck after a lot of physical therapy, you can do a manipulation under anesthesia, which is when the person goes to sleep, and basically I manipulate their arm while they're sleeping and they don't know it. And then even more rare, if that doesn't work, then you can do surgery where you'll actually physically release the capsule, and you can do that through a shoulder scope. So that's kind of the general course of adhesive capsulitis. Like I said, the good news is it goes away on its own. The bad news is it can take a really long time. And I think steroid injections and physical therapy are a good bet. So I hope I was able to answer your questions. If you have any other questions, feel free to leave them in the comments below and I'll respond. Otherwise, you can subscribe to my channel. I come out with new content every week, and hit that like button.